Giving foreigners better healthcare than Canadians. I'm Lilley with TheRebel.Media. Well, just in time for welcoming more than 25,000 refugees from Syria, the new Liberal government has announced they will reverse changes to the refugee healthcare system brought in by the Conservatives. Everyone cheer, hip hip! No. See, starting back in 2010, the Conservatives promised and later delivered on changes to make sure that the refugees and even failed refugee claimants were not getting better health care coverage than Canadians were getting from their own government plans. Under the old plan, that's what was happening. While most Canadians relying on government health plans could not get eye care fully paid for or had to pay part of it, where they could not get dental care fully paid for, refugees were getting all of it. It was a gold-plated plan. And then back in 2010, then Immigration Minister Jason Kenney told me this program, in my view, should be no more generous than is typically the case within provincial healthcare programs. But Kenney didn't stop there. He also said he wanted a real review. He added, if there are certain critical healthcare services that are not covered, we should look at that as well. That's true compassion. And in the end, that's what happened. Some things that Canadians cannot get from their government plans, like eye care and dental care, well, they were taken away. But other procedures, including easier access to surgery, were added to the refugee plan. You never hear of that, though, do you? You're just told things were cut. The Conservative cuts actually meant refugees were getting better access to basic medical services, even if some things were cut. But the media only talked about the cuts. They were too lazy or too partisan to check the claims made by the Liberals, the NDP, or the refugee advocates. Now, current Liberal Immigration Minister John McCallum is promising to reverse those cuts. He calls them draconian. Back when Kenney made these changes, we had provincial governments, premiers, and provincial health ministers writing to the feds demanding that they restore the old system, reverse those so-called draconian cuts, even though the cuts in reality only stop paying for things that their own provincial plans would not pay for. Let's get a reality check on what these cuts were really all about. The current plan in place, the one with all the cuts, provides tiered access to health care depending on what category the person falls under. But suffice to say that even failed refugee claimants, people that have been ordered out of the country, inadmissible to Canada, still have access to basic health coverage until they're finally sent home. Under the Liberals, we can expect the limited deportations to slow down and the healthcare benefits to ramp up. Under the current plan, refugees being resettled into Canada get full basic coverage, plus prescription drug coverage. They also get supplemental coverage. They can get diabetic supplies, mobility aids paid for. The plan goes down from there, and once a refugee qualifies for a provincial plan or gets a job with drug benefits, that part of the federal coverage goes away. The new government, the new Liberal government, is going to bring back the gold-plated plan for all, even failed refugee claimants, people ordered out of Canada. I wonder if they will reverse the other changes, though? The ones that expanded basic medical coverage? Probably not. Nor will you hear about that from other media outlets. No, now it's all about Canada's new Liberal government spending your money as quickly as they can to give refugees better coverage than you can get.